Everybody, welcome to our fellowship Q&A session about the U.S. Health System Reporting Fellowship and the International Health Study Fellowship. Our applications have opened up and we're excited that you all are here. So we'll go ahead and get started. Thanks. You may mute if you're not muted already. Fabulous. Okay, we're going to run through just some quick welcome and introductions. My name is Andrea Weiner. I'm the Director of Engagement for the Association of Healthcare Journalists, and I will pass it to Catherine on our team to introduce herself.
Hi there, I'm Catherine Reed. I'm Director of Education and Content for AHCJ.
And then Kelsey, if you want to go.
Hello, everybody. My name is Kelsey Ryan, and I'm the Executive Director of AHCJ.
Fabulous. And then Andrew, will you introduce yourself? Unless I caught Andrew off guard. That's right. We can go to our...
Go.
Oh,
no,
thank
I
you.
got it. I got it. It just didn't respond right away. So I'm Andrew Holtz, and I've been working as a mentor for both programs since second year of the domestic one and every year of the international one.
Fabulous. And I will have our two fellows introduce themselves when we get to their section so that they can talk about their experience a little bit. So just give you a brief background on AHCJ. We're the Association of Healthcare Journalists, and we are all about setting new standards for healthcare reporting. We believe in accurate, contextual, and balanced healthcare reporting is more important than ever, as I'm sure you know. And then people depend on those stories to make life-altering decisions every single day. So we're proud to partner with the journalists who take this responsibility so seriously. You all and many other journalists have made it your life's work to keep the public informed about some of the day's most important topics through your fair and balanced reporting. So that is AHCJ. Next, we're going to dive into our programs here. So we have the U.S. Health System Reporting Fellowship, which is a year-long fellowship supporting your big reporting projects. And then our International Health Study Fellowship is a 6-month fellowship focused on comparing the U.S. healthcare system to that of another country. So we're going to go over just kind of a brief history of the program, and that's going to be Andrew.
Great. Yeah. So the domestic, what had been called the Healthcare Performance Fellowship, and now I think it's more appropriate to call it the U.S. Fellowship, has been going since 2011, and it generally has 5 fellows from news organizations, a lot of staff, a lot of freelance. It's a mix who come and work on digging really deep into some healthcare policy issue and how it plays out, and often comparing different locations within the U.S. And then the international one started in 2019, which of course meant that the second year was 2020. And our fellows were over in Europe when everyone was recalled home for the pandemic. So we finally got the program restarted this year. Had 4 fellows, so there are generally 4 fellows in the international program, and just finished our 3rd year. So it's still I would say a relatively new and evolving program. We're learning each year how to make it better, and looking forward to this coming year being the best yet. And it generally includes, as we'll hear from Ariel, I think the people in your newsroom might think you're getting a 2-week vacation to Europe. It's actually a lot of hard work, but also some of the most fun you'll have as well, being a journalist. So that's a brief overview. We've had about a total of around 80 fellows in both programs, and really looking forward to working with the next group.
Thank you so much. All right, so let's dig into our first fellowship, which is the U.S. Health System Reporting Fellowship. This was formerly the Fellowship on Healthcare Performance. We've got a rebrand, so we're excited about that. Catherine, I'm going to toss it to you to talk about the fellowship.
All right, so this is a fellowship for the journalist who wants to do a big story or a series of stories about some important and timely aspect of the U.S. healthcare system. And there's a range of topics that could be addressed. You know, in recent years, we've had projects on why is there still so much diabetes in the United States when we know how to treat diabetes, or maternal health mortality, or the lack of care for adolescents with substance use disorders. What are the root causes of medical errors? So this is for journalists who have at least a few years of experience and really want to dive deep into something. So just some aspect of the healthcare system, and particularly, I think we value projects that will in some way look at how could the healthcare system be more equitable. You know, so what are the root causes and what are potential solutions? So eligibility, you have to be a US-based working journalist who would qualify for AHCJ professional membership. And if you're not sure, please look that up on our website. Again, yes, several years experience in health reporting and have the support of a publishing, or I guess really it should say, or broadcasting outlet, because obviously we're not just looking at print journalists. So the selection process is basically by committee that will be looking at applications as they come in. And what we do is we use a matrix to sort of look at several different elements to see how well suited you are, and, you know, also how supported you are in pursuing a project that is really going to take, you know, some of your time and really does require the support of your newsroom or an editor you're working with on a freelance basis. So that's how that works. So what's covered by the fellowship? So there are several meetings with your fellow fellows, and we support that financially with meals and lodging and travel. You will receive mentorship, a project allowance of up to $2,500 to cover reporting trips that you might need to take within the country to report your story or buy data, or other expenses that might come up. And they just vary depending on what the project is. We also support your attendance at our annual conference, including travel, lodging, and registration. You receive 1 year's professional membership in AHCJ, or I believe a renewal if you're already a member, and a $5,000 fellowship award for the successful completion of the project before the end of the year. Yes, there is a deadline. Any questions about any of that before we go on? Okay. All right. So this is the basic timeline. The application deadline is October 4th. The committee will look at the applications, as I said, as they come in, and fellows will be notified in November. And we'll announce the 2025 fellowship class in December. And the orientation will be in January 2025 in New York City at the headquarters of the Commonwealth Fund, which supports this fellowship and the International Reporting Fellowship. The next seminar will be at our conference next year, which will be in the late spring. And then the final meeting. Oh, and I should say that when we meet there, we will also have some additional training elements for the fellowship class. We gather for one or two things, either right before or right after the conference. And then the final gathering is in the fall of 2025. And at this point, you would be wrapping up your project and really talking and thinking about the big lessons learned and the big takeaways from undertaking this project. So that's the timeline. And joining us today is Kira McCarthy, who's doing a project on the sharp decline in childhood vaccination rates in Texas. Kira, you want to talk a little bit about your experience with the fellowship?
Yeah, sure. Thank you so much, Catherine, and thanks everyone for joining us today. So yeah, I work for the Fort Worth Star-Telegram, which is the local kind of legacy newspaper in Fort Worth, Texas. And I've been here for a couple of years, and in Texas, vaccination data is a little bit different than in a lot of other states. It's a little bit harder to access, and the best way to access it is through this report that schools give to the state health department. And for the past couple of years, every time that report has come out, the numbers have dipped. And when I've, asked local pediatricians why there are fewer kids getting vaccinations, they said, we don't really know. And so after a few years of kind of writing that same story, I really wanted an opportunity to be able to answer that question, because I think that's something that reporters are really well placed to do. And so was really excited to be able to have the fellowship support to answer that question. And I have been able to answer it, which is really exciting, and is something that I wouldn't have been able to done without the fellowship support. For me, I think the biggest benefit for, I think, somebody who's working in a newsroom, or maybe you have a story quota every week and you're really expected to participate in the daily news coverage, I think having the support of an outside organization like AHCJ, and both the financial and logistical support that comes with the fellowship, it really gives your newsroom a reason to allow you the time to focus on this project. And this is definitely the biggest project I've ever undertaken in my career, and something that I don't think I could have, and I know I couldn't have done if I just said to my editor, let me do this on my own. And I think having that outside support and the outside accountability as well is really what allowed it to happen. I actually am a little behind, and Catherine and Andrew are being very patient, and I haven't published my first story, but it will hopefully be coming out in the next couple of weeks. Yeah, I just can't say enough good things. I also would note that one thing that's really helpful is, especially if you're in a smaller newsroom or you're a freelancer, I really enjoyed having other health reporters and health editors to talk to. I love my colleagues. They're wonderful. None of them are focused on health, and kind of have quite the same background as the folks that I met through this fellowship. And so that was really a tremendous asset to be able to talk to people who have reported similar stories, or maybe you're reporting very different stories but have been in similar contexts. And so that was hugely beneficial. And then in addition to that, just the extra training is just huge. I think most newsrooms, fewer and fewer newsrooms these days, will pay for you to go to conferences, or will pay for academic enrichment opportunities. And so getting that as well is just incredible. So yeah, I've really had a wonderful year. I'm sad that it's drawing to a close, but yeah, I think that's my 2 cents on the fellowship, and happy to answer any questions, or if there's anything I missed, Catherine or Andrew, please let me know, and I can expand on that.
Thank you.
No, I'm really glad you mentioned the support that you get from each other as a fellowship class. I mean, it's really cool for us to watch too, from the beginning to the end of the year, to see how tight people get and how supportive that everyone gets of each other. It's just amazing.
We love a professional development opportunity that also yields a community.
Yeah.
Absolutely.
Yes,
thank you so much for sharing. If there's no questions right away for the U.S. Healthcare Reporting Fellowship, we'll move on to the International Health Study Fellowship and talk about that. Catherine, it's back to you.
Oh, look how cute they are.
In Central Park.
In Central Park on a snowy but beautiful day, walking across Central Park to the Commonwealth Fund headquarters for our meeting last January. Oh my gosh. So the International Health Study Fellowship is just an amazing opportunity to contrast some aspect of the U.S. healthcare system to something happening in another country. And I know Ariel is on the call and is going to talk about her experience. So, and what she did. And so I'm not going to talk too much more about that, but this is a shorter duration fellowship where we sort of front load the fellows as best we can with the ability to go abroad and with a specific project in mind that does a comparison that U.S. readers will find, or listeners will find, beneficial in understanding the U.S. healthcare system, or even envisioning the way other countries deliver some aspect of healthcare, or address a healthcare issue. So eligibility, US-based working journalist who qualifies for AHCJ professional membership. Again, if you just joined us a little bit late, the description of how you qualify for an AHCJ professional membership is on our site. For this fellowship, you should have at least 10 years experience as a professional journalist, preferably with strong experience covering healthcare policy and delivery at the national or regional level. A current passport is very handy because you are going to be going abroad, and it should be valid for up to 6 months after the reporting trip departure date, or you will end up in a very weird situation in an airport. Happened to me once. Okay. So the selection process, similar to the domestic fellowship program, a committee will review each application as it is submitted. Applications will be judged against a matrix of criteria, including the project proposal, project impact, experience and qualifications, and a project sample. We'll be looking for applicants who we think really could do what they set out to do, and have some background at least, or demonstrate a deep interest in this subject as reflected in their journalism. This is something that I really, want to go out and take a very close look at. And this is why I think it's relevant to the audience for my work. And I see that there's a message in the chat. Oh yes. And by the way, if I am talking quickly and you're thinking of a question, don't forget, we're going to answer all your questions at the end of this. Okay, so what's covered by the fellowship? Training and mentoring, travel to and lodging and meals in New York for Seminar 1, up to 2 weeks of overseas reporting. So travel to a European country agreed upon with the fellowship leaders, lodging in that country, reasonable transit focused on reporting within that country, assistance with reporting expenses, meal incidental expenses stipend, travel to and lodging in London for Seminar 2, and a meal incidental expenses stipend, a year's membership in AHCJ, new or renewed. So the timeline is very similar, but ends sooner. So we'll start looking at applications as they come in. The deadline is October 4th. The selection committee will look at them as they come in and make its decisions and notify selected fellows in November. And then in December, we'll announce the 2025 fellowship class for the International Study Fellowship. The orientation will take place in January in New York City, and we will once again be tromping across Central Park in our boots, won't we, Andrew? And then in the spring, the fellows take off for their various countries of destination to report their projects, and then wrap up their projects just as soon as they can by June 30th, I believe. Andrew, please correct me if I'm wrong, but I think June 30th was the date by which we hoped that all of our fellows would have their international projects wrapped up.
Right. Yeah, basically a six month fellowship.
Yep. So published or broadcast. Okay, so Ariel, why don't you tell people about your fascinating project? I love this project.
Thanks, Catherine. Yeah, so I was a fellow this past year. I'm a reporter at CQ Roll Call in Washington, D.C., where I cover like health policy on the Hill. And my project looked at what the U.S. can learn from first trimester abortion bans in France, and like how public perception of abortion limits differ between the U.S. and France, because France has a 14-week abortion ban, which is very similar to like the abortion limits that have come into play in the post-Roe era. So how does the public perceive these limits? How does that differ from what's in the US? And I was inspired to do this because in my reporting on the Hill, I'd oftentimes hear Republicans sort of saying, oh, Europe is so progressive. Europe is so, ahead of us on healthcare, but they have first trimester abortion limits. Why can't we do the same thing? And my whole idea was just kind of to fact check that and see if Europeans are cool with a first trimester abortion limit. But from my reporting, it sort of turns out that a abortion limit in Europe is very different than what we see as an abortion limit in like the southern half of the US. Just two very different concepts. So for my project, I traveled all around the country. I spent time in Paris, Montpellier, and Lille to sort of get a sense of how like bigger cities, and I traveled to some smaller towns, like how abortion access plays out, and talked to a lot of doctors, went to a lot of clinics. I was very lucky timing wise. When I was there, the French government voted to enshrine abortion access in their constitution. And that was just total luck with timing, but I got to cover the vote from Versailles when they have a joint meeting of parliament. It's at Versailles, so that was really cool and just fascinating. And what I've loved about this fellowship is so much of what I learned reporting over there, I've like gotten to take back to my reporting here in DC. It's just so interesting to see how a different government works, how a different healthcare system works. You know, it sort of brings you out of the brings you out of the trees to see the forest. Is that the right analogy? And it's just like the US doesn't have to do things in a certain way. So maybe I went a little bit too fast. In France, the way they essentially do it is, yes, there's a 14-week abortion limit, but anything past that, just a handful of doctors have to sign off on it and say, okay, this woman clearly needs health care. We think it's a good idea. So their abortion limits just look very different. And like we were talking about before, the mentorship, the working with the other fellows was such a highlight of this. I feel like I created great relationships with other journalists and learned so much from Catherine and Andrew. And the travel, just I can't speak highly enough of this. It was one of the best reporting experiences I've ever had. So if you are covering something in your home newsroom and you want to just sort of step out of your everyday beat, this is a great opportunity.
Thank you, Ariel. That's great.
Talk about opportune timing. We were sort of living vicariously through you when we saw news alerts and things coming in and seeing your reporting too. It was cool to see.
Yeah, I remember thinking,
Yeah.
oh my gosh, Ariel's there right now.
It was so lucky, and it was the first day of the fellowship, which was absolutely wild and set such a tone. So when I was in Paris, because I spent the first week in Paris, everybody was like very politically attuned to abortion access in France. There were like protests and marches in the streets, and it was just like so easy to talk to people. And so one thing about this fellowship is you don't have to speak the language. So part of our budget, I was able to hire an interpreter to work with me or no, we call it a fixer, not an interpreter. She wasn't doing like live interpretations, but she sort of like facilitated conversations. And then afterwards she would go over the recording of the interview and sort of like do a transcript for me, which was really nice. So don't worry, like if you don't speak fluent French, you don't have to speak fluent French. Like you can go somewhere and not speak the language.
But you speak some French, right, Ariel?
Like a little bit. Like
okay.
talk to a taxi driver.
Yeah,
But
okay.
I can't like conduct an interview with a patient in a medical clinic. You know what I mean?
Yeah. And one of the things that Andrew and I have talked about doing even more of with this next fellowship class, of course, is helping people who've never worked with a translator or a fixer get ready for how to do that and how to find people. So
Yeah.
well,
And
thanks,
something,
Ariel.
yeah, go ahead. Sorry.
That's cool. No, I mean that was a great summary.
Thank you so much. All right, so now we've given you your 40,000-foot view of both fellowships. We're going to talk about application process and some tips. And this is going to be coming from our executive director, Kelsey, to talk about application materials.
Yeah, thanks everyone. And thanks to our two fellows for sharing your insider experience. We're going to get into some nitty gritties now and kind of give you hopefully the tips for a successful application and for you to understand very transparently in a moment how the judges are looking at these applications so that you can make the best application possible. So, you've got to put an application together, like Andrea mentioned before, while the drop dead deadline is October 4th. We will be looking at applications as they come in, and that is, to get it in early is really, really, really encouraged. You'll need to put together an actual proposal, right? And in that proposal, up to 2 pages, why it's a good story for your audience, why you're wanting to do this story, the reporting locations. We want to see that this is a revelatory story, not something that's been covered over and over again. Or if you are covering something that's been covered before, how are you bringing something new to the reporting or pushing the story forward? And so that's going to be really important for us to see. You'll have to complete a pretty straightforward application form. We also want to see your elevator pitch. Can you say in one sentence what this project is? Can you define it clear enough to get it into a sentence? And that's very difficult to do if you don't have a clear idea of what you're doing. So we want to be able to see that you have a vision. We want to know why you are applying and how it will help your professional development. Fellowships are our professional development experience. They're so important for journalists. And we want to know kind of your story on why this is important for you and where you are at in your career. We also want to know the impact or potential impact reporting on this will have. So, we don't have crystal balls. We don't know for sure that we're going to be able to write a story that's going to change a law or have a huge public policy impact, but we want you to be thinking about what that impact is and to be able to communicate what you hope the impact of reporting on this issue will be for your audience and your community. And then we need to know a little bit more about who you're writing for. Who are you serving? Who do you hope to impact through this reporting, with some more information from your audience? Of course, a current resume or CV. And then this is very important as well, a letter of recommendation and a pledge to publish from your employer, or if you're a freelancer, from an assigning editor. We need to know that the project that you're putting so much blood, sweat, and tears into is going to have a home, that it will actually come into existence and fruition, and is not just going to be an exercise for you, but is actually going to be published journalism. So that letter of recommendation and a pledge to publish is incredibly important. And if someone has all these great things, but they don't have that key component of the application, unfortunately, we will not be able to move forward with your application. And then at the very end here, we have the best work sample. We just want to see one, right? We just want to see one crowning achievement of the last 12 months. Give us a taste for what you can do, and why your work can do this fellowship. We want to see that, again, you have the ability to do this. It might be a little bit of a stretch, as all professional development should be for you, but we want to see what your best foot forward looks like so far. So some other tips here, we also want to see some evidence. It doesn't have to be that you've written extensively on the topic before, but we want to see some evidence in all of these applications that you've done your research. You understand some of the key areas that people have, if they've written on this topic before, have already put forth into the world, and that you've done background reporting on it at the very least. So that it's not a completely fresh idea. We don't want to see something that you just sort of cobbled together, that you did 5 minutes before the application was due. We want to see some evidence of research and background. And we want to see as much specificity as possible, especially if you've covered something, or if you're planning on covering something very deeply. What will make this revelatory? What will make this new? Again, what will push the story forward? We also want to know that you will be able to dedicate your time to the fellowship. This isn't a one and done kind of thing. There are seminars, there's check-ins with your mentor, there's completing the project itself. This is an intensive, transformative experience, and we want to make sure that you're fully engaged. And then, of course, why is this important to your audience and who you serve? If it might be a passion project of yours, but if it doesn't align with who your outlet or your freelance outlet publishes for, that's a mismatch. So we want to be able to understand why this is good for you now and for the people that you write for or publish for. All right, so here's the nitty gritty, right? I don't know that we've ever publicly put the matrix out there. So we want to,
This was the
yeah.
first time.
This is the first time. So we want to be really, really transparent with folks so that you can kind of see the questions that the judges and the committee are really digging into when we discuss applications. And so, this is hopefully going to make your applications even better by having this kind of inside knowledge of how the judges are going to be looking at your proposals. And you can see that some of the different areas are weighted as well. So there's going to be some areas that have like up to 20 points for an application versus some that are just like a 5-point part. And then we look at all of those together. And this hopefully takes some of the subjectivity out of the judging process. And again, makes it more transparent for folks who are applying. So, I'm kind of hitting on those top tier areas here under project proposal, impact, experience qualifications, and sample. And this is all, again, you must have the completed form done. You need to meet the basic eligibility requirements first and foremost, and then we dive into, these specific judging criteria and areas. So if you don't meet the eligibility, it's not going to get to this point. Frankly. So we want to make sure that people are aware of that first and foremost. But, under the project proposal itself, we want to look at the relevance, significance, originality approach. And then also, like, is the scope of the project defined? Is it relevant to the U.S. healthcare system or a U.S. audience, especially for this international piece? You're writing still for a U.S. audience. And does it in some way address the concept of health equity or systemic disparity? So we're looking at systems, right? We're looking at kind of solutions journalism approaches. And so that is something that we're going to be looking at as judges. And then is the significance of the reporting well explained? Does it demonstrate a creative and insightful way of looking at this issue? And does it present a novel angle or approach or perspective? So again, are you pushing the story forward? Or are you just proposing a project that other people have already done before? We want to see some new ground covered. And then, of course, have you kind of done that background research? Have you looked at the reporting locations, potential sources? Do you have a research plan? Do you have a plan of attack for how you're going to tackle a 6-month to a year-long fellowship in each of these cases? For impact, again, we know this is potential impact. We don't expect you to be able to have a crystal ball to know exactly how your story is going to be received, by the powers that be or people in your community, but we want to know that you're thinking about those things. So can you effectively describe the impact of the reporting that you'd like to see? And can you perhaps give us some quantitative and qualitative impacts that you'd like to see? So, things that are measurable or things that would just bring or raise awareness around an issue, or anecdotal, of course. And then audience alignment, we want to know that you can, one, describe who your audience is, that you have ideas of what the potential benefit will be to this audience for all of this investment in your time and effort. And then does this project have an audience that can act on the information? We do want to know, like, can this story not just be for journalism's sake, but can it actually move the story forward? If people read it, could there be a potential change? And then experience and qualifications, this builds upon the eligibility requirements we talked about earlier. Do you have a track record? Do you meet the eligibility requirements with experience? Are you equipped to handle the research analysis reporting required? Of course, by giving us some more background and research plan, that will help us feel more confident that yes, you do. And then will it contribute to the field for years to come? We want to know again that this is going to push journalism forward. Diversity and inclusion, of course, does the work that you do, basically contribute to an inclusive journalism landscape, and does our cohort of fellows represent, diversity of identities? That's really important to us as well. And then, of course, the project sample, right? We said we want to see your best foot forward from the last 12 months. And so we want to know, did you submit a really good piece? Is this piece perhaps representative of where you're at in your career and how you can, how we can expect you to possibly perform for the fellowship. So hopefully this gives you some insights into some of the questions that the judges will be looking into, and we'll be discussing as we go through all of these different applications. And we really want to, like I said, have a really well-rounded application selection process. And hopefully this gives you that kind of look under the hood on how we do that.
Thanks, Kelsey, for the peek behind the curtain. This is your first of several reminders. Apply early. Applications are reviewed when we get them. The final deadline for application is October 4th. You have questions that we don't get to here. We're going to get to our open Q&A here. But if you have questions, you can reach out to me. My email is right here on the screen. It's just Andrea@healthjournalism.org. And I will either answer it or funnel you to the appropriate person on our team who can answer that for you. So let's get into it. Let's ask the questions that you've got, since your brains have been percolating around these topics, and I'm sure we're ready to get in the weeds. You can feel free to raise your hand. You can drop in the chat. You can unmute yourself and ask, whatever works for you.
Hi, thank you so much for this information session. I really appreciate it. I wanted to, oh, sorry, I interrupted somebody who put a question in the chat. I apologize
For it.
I know that you've talked about how important it is to have a place that you know that the story is going to be published, or the stories are going to be published, and that makes sense. As a freelancer, I might try to find an outlet that I hadn't previously worked for that is a really good fit, but would it be better to find an outlet I haven't previously worked with that's a really good fit, or try to make a story idea fit an outlet that I have worked with, because that better demonstrates that it will definitely be published?
Boy, you're starting with a tough one. I think if you had a firm enough idea of what you were going to do, that an editor, well, I was going to say that an editor was interested. I'm afraid that wouldn't quite be enough. That it might be a bit of a stretch for the selection committee to feel super confident that that hard work was going to have a home. So it might be better to have a project that an editor who already knows you feels sure that they would be that they could commit to publishing or airing. I think that's right. Kelsey, well, how do you, yeah.
And I agree. You should have something locked down, but but also reach out to others, especially if your clients are willing to share you. We had a fellow a year or two ago who had a commitment, who was working freelance, but had a commitment for her stories to air on NPR, but then also over the course of the year did stories for The Guardian, and was able to do some stories that really advanced her project, but that NPR was going, yeah, they were kind of meh about, and she found The Guardian and said, yeah, we want that story. So I would say go both ways. Lock down a commitment with an editor who knows you, that you know them, and you say, yes, this is the basic package is going to work. And then you can reach farther, and if you get more, get broader distribution, get to do aspects that maybe your usual client isn't as interested in, then that's bonus points.
Thanks for the question, Lindsay. We got a couple in the chat. Jesse has asked, can you provide an example of what you mean by qualitative and quantitative impact, please? That's Kelsey. I'm going to throw that to her because she loves data and impact.
I do love data. I think we want to just see that you're thinking about it, not just in terms of, oh, this will influence people, period, right? Right. We want to see you think a little bit more deeply about whatever the topic is that you're working on. So I'm just going to make these up. I'm not saying that this is the end all be all. Okay. So don't just repeat this think about it for your story, but maybe a quantitative impact could be that we're going to see, a singular law change based off of this, or a singular public policy change for XYZ issue. And that would be considered, you know, a numerical thing, right? Like we saw a law change or we saw this. That's really hard to predict, of course, right? But maybe you could say that I would expect that, and this is again a little bit squishy, maybe you know, part of the impact will be that our newsroom will also host a community listening session, or 2 or 3, a series of community listening sessions that will engage XYZ number of people to keep the conversation going. That's a little bit squishier because it's more around audience engagement, but it shows that you're keeping the conversation going. It's not just we published and then we stepped away and we're done. And then qualitative impact, of course, is something around like influence, shifting public awareness, that kind of thing. We want to keep this fairly open-ended, right? How does your newsroom or your outlet or you personally define impact? We just want to see that you're thinking about, I didn't just write a story, put a story into the ether and call it done. You know, I did journalism for the sake of journalism, I called it done. You know, we want to see that you're thinking about the impact of the work longer term, that the thing you do has an outcome later, or that you're thinking about those outcomes. So hopefully that gives you a little bit more to kind of noodle on. And, you know, like I said, this is going to be different for every single person's proposal, and the audience that you work for, the community that you work for, the outlet you publish in. But we want to just see that you're thinking deeply about that.
Thanks for your question, Jesse. Meryl has asked a question. She asked about, oh, I clicked the X. Okay. Can you clarify that the International Fellowship pays for expenses, but there isn't a stipend like there is for the other fellowship? That is correct. So what's covered by the International Fellowship, you get your training and mentoring, you get your travel and lodging, and meals for the seminar in New York City, and then you get up to 2 weeks of overseas reporting covered. So that includes your travel to the country, lodging in that country, transit as reasonable, assistance with reporting expenses, like Ariel mentioned, the fixer translator type folks, and then meal and incidental expenses while you're there. You also get travel and lodging to and from London for the seminar, the second seminar, as well as your meals and incidentals included in there. So you don't get the stipend, the project completion stipend that you do with the U.S. Health Systems Reporting Fellowship, but this one is a little bit different because it has a significant amount more travel and it's overseas. So hopefully that answers that question. And I got a message. This is from Karen. Karen asked, any particular considerations for someone who has done the domestic fellowship if they're considering to apply for the international one?
All applicants are welcome. There's no rule that you can't apply for the other one if you've done one already.
And that's actually happened once before. We have Noam Levy did both and did well at both.
Yeah, we've seen some overlap in the past. So Karen, do apply.
And also I'd encourage,
Awesome.
if you have good proposals, I mean, this probably wouldn't apply for you, for Karen, for this particular one, because you've already done the domestic one. But if there's a person who hasn't done either and you have a good proposal for both the international and the domestic that you want to put forth, you can, and we encourage you to apply for both. That's perfectly fine. You don't have to pick one or the other to apply for. That just, you know, great, makes your chances even better, honestly. So.
We love a go-getter. Anyone else have any questions that we can answer for you about these fellowships, about application process, maybe outcomes of published materials, anything like that?
Oh, there's a question in the Q&A from Terry.
Oh, yeah.
A question about the future. Is there a reason it's only Europe, or is there any consideration in the future to, say, include Central America? Kelsey, I'm going to let you should answer this one.
Yes, I can answer this one. So to kind of give you some background, you know, this particular fellowship started, and maybe Andrew could answer the historical part a little bit better, but essentially, when the genesis of this fellowship happened, basically we were looking at, the most comparable systems to the U.S. healthcare system. And I know that's again, a subjective thing. I can tell you that, right now that is Europe for this year and has been for several years. However, next year we will be expanding the country pool. I cannot tell you that it will be Central America, but I know that it will be more broad than Europe. So we are still working on the details of that. But yes, the goal is to be, I guess, truly international in the future. We are working toward that. As you can imagine, logistically, especially bringing all of the fellows together in one central spot for seminar 2 for the International Fellowship. If you have people that are literally on the opposite side of the globe and are not even on the same continent, that becomes a bit of a logistical issue in terms of just and pricier. Yes, thank you, Andrea. Yes, there's more money involved in longer flights as well. And time, right? Because journalists only get so much time for the reporting trip itself. You don't want to be stuck in an airport for 48 hours on a plane. So just know that that is something on our radar. That is something that we are wanting to expand. But as Andrew noted, the International Fellowship has only been around for a couple of years and then had that COVID interruption as well. So that is where we are at in next year's cohort for 2026. So yeah, year after this, I guess technically, we will be expanding beyond Europe. More to come on that.
That's a great question. I know that has come up several times throughout the application process. Claire dropped a question in. She would like to know, how hard and fast is the 10+ years of experience rule? Would you consider an earlier career journalist?
If someone has 8 years of experience and they have a really phenomenal application, we're not, or something like that, we're not gonna be like, nope, just throw them out. But if you have only maybe 2 or 3 years of experience and you are an early career journalist and you can't demonstrate that you've done these bigger kinds of projects, or that this is going to be something that's we think will set you up for success, then probably not. So that's why we put a suggested 10 years, because usually by that point you've had quite a bit of on-the-ground reporting experience. You've seen a lot of things, you've done a lot of interviews, you've had challenges you've had to navigate, and you have the clips to show it and back it up. So earlier, yes, technically we would probably, have a little wiggle room there. Early career, no, probably not.
We do have other fellowship programs that are totally great for early career journalists, so always keep an eye out on our website for that. We don't want to dissuade you from applying for fellowships in general.
Yeah, and our goal is to not just to say, oh, we don't want early career people to have experiences. That's not it at all. We want to set you up for success, right? If we don't feel like you're at the point in your career where throwing you into Europe for 2 weeks and having to navigate challenges, I'm sure Ariel could talk about all of the fun challenges that popped up during the reporting trip. If we didn't think that you could navigate that successfully, we don't want to throw you into the lion's den. We want to make sure that, yes, it's a stretch and that you're going to be able to get there. But if it's a huge leap for you, we don't think that's going to be a good experience for anybody.
And we have a really good question, and this may be something for our 2 fellow alumni to answer. Jesse's asked, what are tips for coming up with a really strong idea? How much pre-reporting do you do, interviews, etc.? How should a journalist ensure that their idea isn't too broad and is ambitious without being unrealistic?
Mm-hmm. I'm happy to answer. I think, I'm not sure this is everyone's experience, but for me, my topic was just born out of kind of running into the same question in a couple of stories in a row and not being able to get a clear answer from the kind of expert sources I was turning to. And so really wanting to be able to solve that for myself. And then I also realized there was kind of an information gap that I could fill. In Texas, it's the easiest way to get vaccination data for childhood vaccines is at the district level. But for the entire school district for a city, you would know that there's 95% vaccination rate, for example. But a lot of the folks that I was talking to over the years noted that most infectious diseases spread at a much more local level, and so a district-wide rate is not as helpful as a campus-wide rate. And in Texas, if you want to know the vaccination rate for your kid's campus, you have to file a public records request, and even then, it's going to be a lot of hassle. And so that was really clear for me. Like, okay, I can fill that information gap. Like, I know how to file public records requests. I have the time. That's my job. And so I think there was kind of a really clear, I guess, like service or information gap that I could fill with my project. And so I think, I was someone who had been reporting on vaccines for a while and did know it fairly well. But I think even if it's a topic you don't know as well, if you're seeing something that's not getting answered elsewhere, or some reason that your community might be different, I think that's probably a good indicator that you might be heading in the right direction.
Just would totally echo everything Sierra says. Also, I did do a few phone calls on the topic ahead of the application just because I didn't want to, I don't know, I'm very self-conscious and I wanted it to sound like correct. But I think that, if it's something you're coming across in your reporting, just, report it out like you would a story, sort of. Like without being there. Obviously, you're not in the country.
Yeah. And I think it always helps to have an idea of what specific stories you might do. So you've got your project idea, but if you can come up with 4 to 6 specific stories that you think you might do. Now, of course, they're going to change. You should learn things during the project that will alter how you approach it. But you should go into it thinking, well, based on what I know now, making a few phone calls, doing online research, I think this is a series of stories I could possibly do. Then that organizes your thinking and shows that it's concrete. And those often we've seen from successful applications in the past, they have, here are 4 to 6 stories that I will try to tackle. And these are the voices that will be in the stories. I will have, I'm going to look for experts in this area, and I've got these potential names of people who are prominent. These are the kinds of individuals, whether they are patients or people experiencing various health things, that can personalize the story. This is, you don't have to nail down the actual individuals, but this is the type of person I would look for. The way you would approach any individual story, but think, okay, this is not just one story, this is a bigger concept. But when you get back, you're going to have to turn it into individual stories. So having that framework helps from the very beginning.
I would add too that, as you're a beat reporter, especially, there's always going to be those stories that you wish you could work on, those big projects you wish you could work on, that in the daily throes of things, you don't have the time to do. And so this is really the opportunity to do that big project, right? And to get the buy-in from your editor, that hey, like, this is worth it. We're going to have support. We're going to have mentorship. We're going to have some dollars to support this really big, ambitious thing that I've wanted to do. And then I have a baseline of knowledge on. So, I think most reporters have that Google Doc or those notes somewhere, where you're just storing away these really good nuggets of things that there's something deeper there that's worth exploring. And this is the chance to do that really big thing that you've wanted to do for a long time.
Absolutely. Good questions abound. Anyone else have any questions you want to answer in the last 4 minutes of our time together? I want to be respectful of your schedules. I'm going to give time for people to furiously chat.
One thing I do want to reiterate is something that Catherine brought up earlier and others have, is the demonstration of support. That has really made the difference. You may be the best journalist in the world, but if you don't have support, you're going to have a hard time getting across the finish line. So make sure that you've talked with your editor, talked with other, a client, whoever you would work with, who is as enthusiastic about it as you are, and says, yes, this is something we really want to do. This is something, and in the most successful ones we've seen, it's because the news organization realized that this project isn't just a cool thing for the reporter. It is a real, real mark of excellence for the news organization, and can get the whole publication, the TV station, the radio station's goals further, and really say, look, we are doing quality journalism for our community. And this is something that is, frankly, for a boss, a marketing point. Something it's not just, oh gosh, I'm going to lose you off the daily beat while you're working on this project. This is something where say, this is cool. This is something we're doing that our competitors are not doing. So when it goes well, the entire organization really gets on board and supports and benefits from the project. And I was trying to think if there was one other point in there. Also, this is not, don't scare them away by saying, oh, I'm going to have to bow out of any daily news reporting for the next year. That's not how it works. This is, think about something that will stretch you and your news organization, but it won't overwhelm it. It fits in. We understand people have got to do other things. And so think about that, and you can put that in your proposal in terms of how it will work, what kind of show that you will have enough time to carve out a day, a week here and there to work on your project while still satisfying the breaking news needs of your organization. We know you live in the real world. You got to keep your job. And the fellows that have done it have figured out a way to balance doing something special and new and extra with this project while also still continuing to meet the day in and day out news demands of their organization.
That's a really great point, Andrew. I know I used to convince my editor that Fridays were mine, right? Like I could do my projects on Fridays as long as I got all my other stuff done the rest of the week. They seem to be okay with that. So different newsrooms have different ideas of what that looks like, but we want to see that you can really dedicate your time to this.
Well, thank you all so much for joining us. I hope to see all of your applications. Again, reach out to me if you have questions. It's Andrea@healthjournalism.org, and please get your applications in sooner rather than later. The final deadline is October 4th. Again, thanks for being with us today. Go forth and change the world. Thank you.